Millions of people over 60 swallow a white pill every morning thinking they are saving their bones, when in reality they are building a cement wall inside their coronary arteries. That supplement sitting in your kitchen right now, the one recommended to prevent fractures, could be the exact cause of your next heart attack. And it's not the only one. There are five vitamins and minerals that most people consider completely harmless. We even call them miraculous. But the latest science is proving that after your sixth decade of life, these substances act as true silent poisons. They cause unexplained fatigue. They trigger microbleeds in your brain. And worst of all, they accelerate your cellular aging at a terrifying rate. Today, we are going to dismantle the myth that more vitamins is always better. I'm going to reveal the five supplements that are destroying your vital organs right now and exactly what you must do to protect yourself before it's too late. I'm Dr. Cezar Villareal. Throughout my medical career, I have seen too many patients arrive at the emergency room with serious complications caused not by their diseases, but by the pills they took trying to be healthier. My mission on this channel is to give you the medical truth, unfiltered and backed by real scientific evidence, so you can take control of your health and enjoy your golden years with maximum energy and vitality. If this is your first time here, make sure to subscribe and activate notifications so you don't miss any of our longevity protocols. And I want you to leave me a comment right now. Tell me which country you're watching from and how many different vitamins you take each morning. I want to read your message and get to know you. Always remember that this video is strictly educational. Consult your doctor before making any changes to your health regimen. Do not stop or start any treatment without professional supervision. To understand why certain vitamins become dangerous after age 60, you need to understand how your biology changes. Imagine your body at 20 years old as a high-performance engine fresh from the factory. If you add a little more oil than needed, the engine simply burns it off and keeps running at full speed. It has an astonishing capacity for filtration and adaptation, but at 60, that same engine has traveled hundreds of thousands of miles. The filters no longer process excesses with the same speed. The liver is slower to break down toxins. The kidneys take longer to expel what isn't needed. And your digestive system absorbs nutrients in a completely different way. When you give this mature engine a massive overload of isolated synthetic vitamins, it doesn't use them to repair itself. It accumulates them. And that accumulation becomes pure toxicity. What gave you energy at 30 inflames you at 60. What protected your cells at 40 oxidizes them at 70. We are bombarding mature bodies with industrial doses of chemical compounds that nature never designed to be consumed in isolation. In nature, vitamins come packaged with fiber, enzymes, cofactors, and minerals that tell your body exactly where to put them and when to stop. In a synthetic pill, that instruction manual does not exist. That is why what comes next is so important. We are going from the vitamin that secretly weakens your skeleton all the way to number one, the most popular supplement in the world that is literally turning your cardiovascular system into stone. Number 5 is vitamin A in its synthetic retinol form. I call it the silent thief of your bones. For decades, we have been told that vitamin A is essential for eyesight, skin, and the immune system. And it is. But excess preformed vitamin A in older adults is one of the least known and most destructive causes of osteoporosis. Let me tell you about Carmen. Carmen was 68 years old and obsessed with keeping her skin young and her vision sharp. She took a daily multivitamin plus a specific eye supplement containing massive doses of synthetic vitamin A. She was proud of her health routine until one day, stepping down a small garden step, she stumbled slightly. It wasn't a hard fall, it was a simple misstep. But the sound of her hip fracturing was unmistakable. When we checked her levels at the hospital, her bone density was devastated, despite having a decent diet. The culprit was hypervitaminosis A. Think of your bones as a massive construction project that never ends. You have workers called osteoblasts who build new bone. And you have demolition crews called osteoclasts who remove old bone. It is a perfect balance. But when you flood your body with vitamin A supplements, You act like a crazed foreman who hires hundreds of extra demolition workers and fires all the builders. Excess vitamin A massively stimulates osteoclasts. Your bones break down far faster than they can be rebuilt. A landmark study led by Dr. Ulf Lerner at the University of Gothenburg in Sweden demonstrated something chilling. They found that sustained vitamin A intake above the recommended daily amount causes significant thinning of the bones. Excess retinol blocks vitamin D's ability to absorb calcium. Basically, you are taking a supplement to see better, but you are making your bones as fragile as glass. The practical solution is very simple. Stop taking supplements containing retinol or retinol palmitate unless you have a clinical deficiency diagnosed by a doctor. Instead, get your vitamin A through beta carotene. Your body is incredibly intelligent. If you eat carrots, sweet potatoes, or spinach, your body absorbs the beta carotene and only converts it into vitamin A if it truly needs it. The rest is safely discarded. You can never get vitamin A toxicity from eating vegetables, but you can destroy your bones by taking pills. And if you think that's dangerous, wait until you hear how the next supplement deceives your doctors while your brain deteriorates. Number 4 is synthetic folic acid. I call it the neurological illusionist. Folic acid is the artificial version of vitamin B9. It is famous for preventing neural tube defects in pregnant women. But in adults over 60, taking high-dose folic acid supplements is like playing Russian roulette with your brain. Meet Roberto. Roberto was 71 years old. He was feeling a bit tired, so he went to the pharmacy and bought a high-potency B complex containing large amounts of folic acid. Within a few months, the fatigue improved slightly, but he began noticing something terrifying. He felt constant tingling in his hands and feet. He started forgetting his grandchildren's names. He was losing his balance when walking. He went to his doctor, had routine blood tests to check for anemia, and the results came back perfect. His red blood cells were flawless. The doctor told him everything was fine, that it was just aging, but Roberto was suffering irreversible neurological damage. What was happening is a medical phenomenon known as the masking of vitamin B12 deficiency. As we age, our stomach produces less acid and less of a protein called intrinsic factor. Without this, we cannot absorb vitamin B12 from food. B12 deficiency causes two things: severe anemia and devastating neurological damage that destroys myelin, the protective sheath around your nerves. Normally, doctors detect this deficiency quickly because they see the anemia in your blood tests. But here is the trap. If you take high doses of synthetic folic acid, it magically corrects the anemia in your blood. Your tests come back perfect. But folic acid does absolutely nothing to stop the neurological damage happening in your brain and nerves. It is like having a wall covered with moisture and black mold. And instead of fixing the broken pipe, you simply paint it with 3 coats of white paint. From the outside, it looks beautiful. But on the inside, the structure of your house is rotting and will collapse. Massive studies following folic acid food fortification in the United States revealed that older adults with high blood folate levels but low vitamin B12 levels have significantly higher rates of cognitive decline and neurological damage. You are silencing the fire alarm while your brain burns. The practical solution is vital. If you are over 60, never take an isolated folic acid supplement without first demanding that your doctor measure your vitamin B12 blood levels, and preferably avoid synthetic folic acid entirely. Look for supplements using methylfolate, which is the active natural form. Or better yet, get your folate from where its name comes from: foliage, dark leafy greens, asparagus, and broccoli. Your brain needs real protection, not chemical illusions. And speaking of cellular destruction, the next supplement is literally a rust accelerator inside your veins. Number 3 is routine iron supplementation. I call it the cellular rust accelerator. There is a deeply rooted belief that if you feel fatigued, weak, or low on energy, you need to take iron. Television is full of iron tonic commercials promising to restore your vitality. But unless you have a doctor-diagnosed deficiency, taking iron after age 60 is one of the most destructive things you can do to your body. Let me introduce you to Miguel. Miguel was 65 years old, an active man who started feeling he tired more quickly playing tennis. Without consulting anyone, he began taking ferrous sulfate pills every day. Instead of regaining his energy, he began feeling a dull ache in his hand joints. His skin took on a slightly grayish tone. His fatigue became paralyzing, and he began having cardiac arrhythmias. When he finally came to my practice, his ferritin levels were through the roof. His organs were drowning in iron. To understand this, imagine leaving a beautiful new bicycle out in the rain for a month. What happens to it? It rusts. The metal reacts with oxygen and corrodes. Exactly the same thing happens inside your cells. Iron is a highly reactive transition metal. It is essential for transporting oxygen in the blood, yes, but the human body is incredibly efficient at recycling iron. We have no natural mechanism to excrete excess iron, except through blood loss. Young women lose iron every month through menstruation. But after menopause and in older men, iron simply accumulates year after year, decade after decade. When you take iron supplements without needing them, that free iron circulates through your blood and generates what are called hydroxyl free radicals through a chemical process known as the Fenton reaction. These free radicals are like tiny sparks of fire that burn your cell membranes, damage your DNA, and destroy your mitochondria. A landmark study known as the Rotterdam Study, evaluating older adults, demonstrated that high levels of stored iron nearly double the risk of acute myocardial infarction. Iron oxidizes the bad cholesterol inside your arteries, turning it into a hard, dangerous plaque. Moreover, studies show that iron overload shortens your telomeres, the biological clocks of your cells. Excess iron literally makes you age faster. The solution for Miguel was simple but radical. He stopped taking the supplement, and we prescribed therapeutic blood donations. By donating blood, his body was forced to use the iron stored in his organs to create new blood. Within 6 months, his joint pain disappeared and his energy returned. The practical protocol for you is this: never take an iron supplement, not even a multivitamin containing iron, unless your doctor has run a complete iron panel including serum ferritin and confirms you have a real deficiency. Eat grass-fed beef, lentils, and spinach. Your body will regulate iron absorption from food naturally. But stay away from the pills. How many of these supplements do you have in your medicine cabinet right now? If you are already surprised, get ready. Because number 2 is a vitamin everyone associates with heart health, but that hides a lethal danger. Number 2 is high-dose vitamin E. I call it the brain time bomb. During the 1990s and early 2000s, vitamin E was hailed as the ultimate miracle antioxidant. We were told it cured everything from wrinkles to heart disease. People began taking massive capsules of 400, 800, even 1,000 international units every single day. But the science finally caught up, and the results are chilling. Listen to Elena's story. Elena was 67 years old. She was meticulous about her health. She took 1,000 international units of vitamin E every day because she had read in a magazine that it protected her heart and kept her skin elastic. One morning while making breakfast, Elena felt a thunderclap headache, the worst of her life. She lost strength on the right side of her body and collapsed in the kitchen. In the emergency room, the CT scan revealed an intracranial hemorrhage. A blood vessel in her brain had burst. Fortunately, surgeons managed to save her, but recovery was long and painful. Why did this happen? Elena had no high blood pressure and no family history. The culprit was her excessive vitamin E consumption. To understand this mechanism, you must know that vitamin E is a powerful anticoagulant. It thins the blood. In normal doses obtained from food, this is beneficial for preventing clots. But when you take massive synthetic doses, it is like putting too much synthetic oil in your car's engine. Instead of lubricating smoothly, the pressure shifts, the seals break, and catastrophic leaks begin. High-dose vitamin E interferes with your blood's ability to clot when it truly needs to. It weakens the walls of the smallest blood vessels, especially in the brain. A comprehensive meta-analysis by researchers at Harvard Medical School analyzed 9 massive clinical trials involving more than 118,000 participants. The results were conclusive and terrifying. They found that taking vitamin E supplements increases the risk of hemorrhagic stroke by 22%. I'll repeat that. 22% higher probability of a blood vessel bursting in your brain and causing a lethal stroke or leaving you paralyzed. And the risk is exponentially greater if the patient is already taking anticoagulant medications like aspirin or warfarin. Synthetic vitamin E hijacks your clotting system. The practical solution is decisive. Throw those high-dose vitamin E capsules in the trash. You do not need to supplement this vitamin unless you have a rare malabsorption syndrome diagnosed by a gastroenterologist. You can get all the vitamin E your brain and skin need by eating a handful of almonds daily, some avocado, sunflower seeds, and extra virgin olive oil. Natural vitamin E from food comes in different forms. The tocopherols and tocotrienols that work in perfect synergy without causing hemorrhages. But as dangerous as a stroke is, nothing compares to supplement number 1. It is the most prescribed, most purchased, and most consumed supplement by older adults across the entire planet. And it is turning your veins into stone. Number 1 is isolated calcium supplements. I call it arterial cement. This is the most important point in the entire video, so I need your full attention. Since childhood, we have been brainwashed with a very simple message. Calcium builds strong bones. And when you reach 60 and your doctor mentions the words osteopenia or osteoporosis, panic takes over. You run to the pharmacy and buy giant bottles of 1,000 or 1,500 milligram calcium pills. You take them religiously every morning, feeling you are building a steel skeleton. But the biological reality is a medical nightmare. Let me introduce you to Rosa. Rosa was 72 years old. She was a slim, active patient who walked 3 kilometers daily. 5 years ago, she was diagnosed with mild osteopenia. Her doctor at the time prescribed 1,200 milligrams of calcium carbonate per day. Rosa never missed a single dose. But a few months ago, Rosa began feeling a strange tightness in her chest when climbing stairs. She was short of breath. One day, the pain radiated down her left arm. She arrived at the emergency room with a pre-heart attack. When the cardiologist performed an angiography to examine her coronary arteries, they were stunned. Her arteries were not filled with soft fat or cholesterol. They were rigid, white, and petrified. They were full of calcium. She had severe coronary calcification. Rosa understood nothing. She ate healthily, was not overweight, and her cholesterol levels had always been normal. Where did all that calcium in her heart come from? It came from the pill bottle she kept in her kitchen. To understand this disaster, we need a very visual analogy. Imagine your body is a city. Your bones are the buildings under construction, and your arteries are the roads. Calcium is the cement trucks. When you eat calcium-rich foods, like a piece of salmon, a plate of broccoli, or some Greek yogurt, the calcium enters your body slowly, little by little. It is like sending one cement truck at a time. The body has time to direct that truck exactly to the building that needs it. But when you take a 1,000 milligram calcium pill, it is like releasing 1,000 cement trucks onto the main highway all at once. A massive traffic jam is created. Your blood is flooded with calcium in an instant. The body panics because such high calcium levels in the blood are toxic. So the body does the only thing it can to save your life. It dumps all that cement onto the walls of the roads. That is, into the lining of your coronary arteries, your heart valves, and your kidneys, forming kidney stones. The calcium never reaches your bones. It gets stuck in your soft tissues, hardening them. Your arteries, which should be like flexible rubber hoses that expand with each heartbeat, become rigid lead pipes. Blood pressure skyrockets. The heart must pump with brutal force to push blood through these stone pipes until it finally fails. This is not a theory. It is hard, proven science. Researchers at Johns Hopkins University conducted a landmark study lasting 10 years, evaluating more than 2,700 people. The results shook the medical community. They found that taking calcium in supplement form dramatically increases the risk of arterial plaque buildup and cardiac damage. Calcium supplements increase the risk of heart attacks by 22%. However, and this is crucial, the study also showed that people who consumed high amounts of calcium through their diet, through real food, had no increased risk whatsoever and actually had healthier hearts. The problem is not the mineral, the problem is the pill. But Rosa's story does not end in tragedy. When we discovered this, we immediately stopped her calcium carbonate supplements. We completely changed her approach. Remember the cement trucks? It turns out that for calcium to know, it must go to the bones and not the arteries. It needs a GPS navigation system. That biological GPS is called vitamin K2. Vitamin K2 activates a protein called osteocalcin, which grabs calcium from the blood and forces it into the bone. At the same time, vitamin K2 activates another protein called MGP, which literally sweeps and clears calcium from your arteries. Additionally, you need vitamin D3, which acts like the toll gate, allowing calcium to enter your body from the intestine. And you need magnesium, which is the orchestra conductor, keeping everything in balance. We prescribed Rosa a protocol of vitamin D3 with vitamin K2 and magnesium. She obtained her calcium exclusively from sardines, almonds, dark leafy greens, and bone broths. Within 2 years, the progression of her arterial calcification stopped completely. Her arteries began recovering flexibility, and her bone density improved naturally without a single toxic calcium pill. The practical and definitive protocol for you is this. First, try to obtain your daily 1,000 milligrams of calcium through real foods. Chia seeds, sardines with bones, almonds, kefir, broccoli. Second, if for strict medical reasons you must take a calcium supplement, never take calcium carbonate. It is pure chalk. Look for calcium citrate or marine algae calcium, and never take more than 300 milligrams per dose. Third, and most importantly, never take calcium without pairing it with vitamin K2, vitamin D3, and magnesium. Without these three companions, calcium is a silent killer that will pave over your heart until it stops. Let's summarize this vital information so you can take action today. Excess vitamin A weakens your bones and accelerates fractures. Synthetic folic acid hides the irreversible neurological damage caused by B12 deficiency. Iron supplements without deficiency oxidize your cells and shorten your lifespan. High-dose vitamin E weakens your brain's blood vessels and increases the risk of hemorrhage. And isolated calcium supplements are the cement that hardens and destroys your coronary arteries. Your body after 60 is a masterpiece of biology that requires precision, not chemical flooding. True nutrition comes from the earth, not from a laboratory. Real foods contain the perfect synergy of nutrients that your body knows exactly how to handle. I want you to go to your medicine cabinet today. Read the labels of what you are taking. And most importantly, schedule an appointment with your doctor. Ask for real blood tests. Measure your ferritin, your vitamin B12, your vitamin D. Do not guess with your health. Always consult your doctor before making changes, because real preventive medicine is based on data, not assumptions or television commercials. Now it is your turn. Go to the comments and write the number of the supplement that surprised you most today. Was it number 1, 2, 3, 4, or 5? I want to see how many of you were taking calcium believing it was harmless. If this information opened your eyes, like this video and share it urgently with your friends and family members over 60. You could be saving their life or preventing a heart attack. In our next video, I will reveal the 3 breakfast foods that everyone considers healthy, but that are destroying your memory before noon. Make sure you are subscribed so you don't miss it. I am Dr. Cezar Villareal. Take care of your heart, take care of your life. See you in the next protocol.